All right, we're about to pull back the curtain on a really silent, kind of mysterious growth that can pop up in one of the most critical spots in the entire human body. This is the story of the carotid body tumor.
Okay, just picture this for a second. You're just going about your day and you feel a small, firm, painless lump on the side of your neck. It doesn't hurt at all, but it's definitely there. So, what could it be? Well, this is exactly how one of medicine's rarer mysteries usually kicks off.
And, this isn't some new medical mystery. It was actually first described way, way back in 1743. But get this, it is so rare that by 1971, there were fewer than 500 cases reported in all of medical literature. That's just wild. And that incredible rarity is exactly why it's so important for us to understand it. So to really wrap our heads around this tumor, we first have to go to the scene of the crime, if you will. And that means investigating a tiny but absolutely vital organ called the carotid body. The scale we're talking about here is just fascinating. I mean, this is a structure that's only about 5 millimeters long. It's tiny, and it's nestled right in that crucial fork where your main carotid artery splits to send blood to your brain and your face. So despite being so small, its job is absolutely monumental. Yeah, probably the easiest way to think about the carotid body is like it's your body's own built-in smoke detector. It's an emergency sensor that is constantly 24/7 monitoring your blood for any sign of danger. And here's how that sensor actually works. It's what's called a chemoreceptor, which basically means it tastes the chemistry of your blood. It's amazing, right? So if it senses that your oxygen is getting low or your carbon dioxide is too high, it sends an urgent red alert signal straight to your brainstem. And your brain doesn't hesitate. It immediately responds by kicking your heart and lungs into a higher gear to fix the problem. It's a totally crucial survival mechanism. Okay, so what happens when this vital little sensor goes wrong and develops a tumor? Let's dig in and build a profile of our suspect. So this tumor, technically it's called a paraganglioma. It's basically a growth that pops up from that chemoreceptor tissue we were just talking about. When you look at it, it's usually this reddish-brown, rubbery thing, and this is a really key point. It is extremely vascular. That just means it's absolutely packed with blood vessels. And it tends to grow really, really slowly, often over many, many years, which explains why it can go completely unnoticed for such a long time. And as this tumor grows, really slowly, it does something pretty unique. It settles right into that fork of the carotid artery and starts to push the two branches apart. When doctors look at this on an angiogram, that's an X-ray of the blood vessels, it creates this really distinctive shape. It's almost beautiful, but also kind of ominous. It looks like a lyre, the old musical instrument, and this lyre sign is a total classic telltale clue for doctors. Which, of course, brings us to the big question, the one everyone asks about any kind of tumor. Is it cancer? Well, with this particular one, the answer is a bit more complex than a simple yes or no. And here's why it's so tricky. With most cancers, you can look at the cells under a microscope and see they're abnormal, but not here. With these tumors, the cells almost always look totally benign. So for these tumors, malignancy is all about behavior. It's about what the tumor does, not what its cells look like. Does it spread to lymph nodes? Does it start invading nearby structures? That's what really defines its threat level. So, given how tricky this thing is, and its seriously dangerous location, how on earth do doctors solve the puzzle and actually confirm a diagnosis? Well, the whole investigation really hinges on modern, high-tech imaging. It usually kicks off with a simple ultrasound, but to get a really detailed 3D map of the area, doctors will turn to either a CTA scan, that's a special kind of CT for arteries, or an MRA, which uses magnets instead of radiation. Both of these can create these absolutely incredible pictures of the tumor and its whole blood supply. Okay, now I really want you to listen to this next part, because it is one of the most important rules in this entire story. You absolutely do not stick a needle in this tumor for a biopsy, ever. Remember how we said it's packed with blood vessels? Trying to take a sample could cause a massive life-threatening bleed. The imaging we have today is just so good that a physical biopsy is not only totally unnecessary, it's actually incredibly dangerous. So once the case is cracked, the imaging is done, and the tumor is positively identified, there's really only one definitive way to resolve this. And that resolution is surgery. Early surgical removal is the absolute mainstay of treatment. And the consensus here is crystal clear. Go in early. Why? because the smaller the tumor is, the easier it is to remove and the lower the risk of any complications. Waiting just gives it time to grow bigger and get more tangled up with all those critical nerves and arteries in your neck. Now, to plan for such a delicate operation, surgeons use a special staging system called the Shamblin classification. You can think of it as their game plan, or how they size up the challenge ahead of them. A type 1 tumor? That's relatively straightforward, but a type 3? That's a whole different ballgame. It's a major surgical feat because the tumor is completely wrapped around those vital arteries. And that classification directly dictates the surgical approach. For a type 1, the surgeon can just carefully dissect the tumor away. For a type 2, things get a bit more complicated. They might have to remove one of the artery branches with the tumor. But for a type 3, the most complex one, the entire fork of the artery has to be removed and then completely rebuilt with a graft. It's incredible stuff. So, with an operation this complex, what's the final outcome?
Right, so after all that complexity, all that risk, what's the final verdict? Is it a good outcome?
The verdict is overwhelmingly positive. And this is amazing. In the hands of an experienced surgical team, the risk of dying from the operation is less than 0.5%. That is just incredible. And it's a real testament to modern surgical skill and meticulous planning.
All right, let's just quickly recap the key takeaways here. First, carotid body tumors are rare, slow-growing, and they come from the body's oxygen sensor. Second, we decide if they're dangerous based on how they act, not how they look under a microscope. Third, and this is a big one, diagnosis is made with imaging, not a biopsy. And finally, the best course of action is early surgery with an experienced team, which leads to excellent outcomes. So when you think about it, we've gone from first describing this thing in the 1700s to being able to safely and effectively remove it today. That's centuries of incredible progress that have turned a rare mystery into a solvable case. And it really makes you wonder, doesn't it? How many other rare diseases are out there right now, just waiting for us to develop the right tools and the right understanding to finally crack them?